My name is Ariane Telgen. I've been working successfully with problem horses for 20 years of all kinds. And another focus of mine is training for both rider and horse. Here I support competition-oriented riders in all classes, but also the leisure sector, in maintaining health, in harmony, and also in composure, so that everyone gets through the terrain safely.
She's totally nervous.
Today, the 18-year-old mare Claraara comes to Hof Eikeneck for an osteopathic treatment. Clara's owner is returning to riding and has various problems while riding that no one has been able to help her with so far. That's why she'll take a training lesson with Ariane Telgen afterwards.
It's okay, it's okay, it's okay. Hold on tight. Whoa.
Yes, good girl.
My goodness. We can probably best saddle up inside and all that, right? Yes, as planned.
So 4 legs.
Hey there, buddies. Good, exactly. That's all good. She's very nervous.
Yes, she's starting to foam too, right? How old is she, do you know?
She's 18.
18?
Yes.
Okay, and if you don't mind me asking, what exactly are your plans for her?
Well, I'm more into leisure riding. Maybe I'd like to compete with her sometime, but it doesn't have to be.
And in which area? Jumping or dressage?
Both?
Both, okay. What class? Starting with E?
Yes.
Okay, I see. And can you tell me a bit about her? So she's 18 now. Has she competed or?
Yes, she was actually a show jumper, you know.
Okay.
ML as far as I know. And they also wanted to breed with her. That's actually why they bought her. The previous owners I bought her from, they tried twice, but it didn't work out. And then she went into the sport with the son, who then rode her in competitions. But then they said she also runs out of steam quickly later in the course. Okay. And then she was supposed to be sold, and then I bought her.
How was the trial ride? Was it like you said, yay, this is it? Or?
Yes, I mean, of course it's unfamiliar. I haven't ridden for a long time. Well, we used to have our own horses and then stopped, but then I started again, so I'm a returner, so to speak.
Okay.
And I was allowed to try her out for as long as I wanted.
That's great, of course, isn't it?
Yes, I could always come whenever I wanted, and
okay, that's already very important. Most people don't really have that, you know, that kind of opportunity.
well, she's very, very sweet and not at all naughty or anything like that. It's just that she's very nervous at times, and she's really bad at standing still in one spot. She finds that very difficult. We are working on that, though.
Okay.
She's afraid of whips.
Mm-hmm.
I've noticed that with her, too. We're practicing that, too. It's getting better now.
Okay.
And, yeah, but when riding, our problem is that at first, she's a bit sluggish, plodding. You always have to really push her forward. It's hard sometimes, but later on, she gets a bit worked up, and then I find it hard to hold her back. Our biggest problem is the contact.
Okay, let me see. In all 3 basic gaits, or?
In the canter, eventually, yes. But from the start, it's really hard, and I just can't get deep in the seat. It's just not a...
But was that different during the trial ride?
Yes, it was a bit different then, but I mean, obviously, I'd only just started again.
Yes, yes.
In terms of muscle and experience.
Okay. So, and you basically signed up for the checkup, right? So we can take a look at her. That includes checking the saddle, of course, and naturally the accessories like the bridle and so on. Yes, and then the riding training. Because of the heat, as we just said, we'll do the riding training first and then the treatment, right? Wonderful. Then I'd say let's go inside and just saddle up as we normally would.
Yes.
So I'll also watch how she behaves, if she nips when being girthed or is restless and all that. And then you can already see a little bit. It'll probably be quite different. Do you usually take riding lessons too? Or not at all?
No, to be honest, it's hard to find anyone suitable around here. I used to have riding lessons all the time. I always went to the arena. But somehow finding a decent trainer is really difficult.
That's true. Good, then let's take a look.
I ask around in the area, but somehow no one can really say anything, and there aren't many people who take riding lessons either.
What? They really don't ride?
No, I don't think so. Well, there's more in jumping, I guess, but real dressage and basic work that's horse-friendly.
So what would be the goal now or your dream? What are you hoping for from today?
That she moves more relaxed, because I feel like she's always totally tense.
Okay,
And yeah, I think that we just need to get the contact a bit better, because honestly, I feel like I'm either way too loose with the reins, or sometimes I'm just too firm with them. And I'm just missing that.
okay. That's my goal. Well, then I'd say we'll focus on that today, finding a way to get her to let go so you have a starting point for what to do at home.
Yes.
If all else fails, then you'll just have to come a few times for training so that it sticks, and then I think it'll be manageable on your own.
Yes, it's very good that we're not that far away.
Great. Then I'd say, should I help carry a saddle or something? Do you want to saddle up out here or rather inside? What would you prefer?
Then let's go inside. I think, because she doesn't stand still very well here. A little fan gift.
Oh, that's really nice. I have to... Look. I haven't even done anything yet. Should I rather give it back for now and you give it to me afterwards?
It's all good.
I just got this as a gift. Totally great. So I have to do this first.
Oh, thank you very much.
You're welcome. Totally great.
Yes, we can do all of that ourselves at our place. So I thought I'll make something.
Oh, lovely. So I guess that means there's no blue then.
Yes, I have to take a dressage one, right?
Should I carry something?
Yes, maybe that one there,
So here's a lunge line. Is it for loading or do you need to lunge her?
No, I thought maybe I'd take it along, but I don't have to.
What do you usually do? Do you usually lunge her first?
Sometimes. Not always.
Okay. What does that depend on? Do you notice when saddling up if it's necessary?
Yes, or during.
Okay, I see. So what I'd like to do now before we actually start the riding session is just to quickly put the saddle on the horse and see how it fits, just to make sure everything is comfortable and secure. If it turned out that the saddle didn't fit quite right, would you still be willing to ride a few laps around the arena, just so we can observe and see how she behaves and responds under the saddle, even if it's not a perfect fit? Then I can explain it a bit so that it's clear to you as well. And if you don't mind, if it turns out to be negative, I'd also like to get another saddle so you have a direct comparison.
Up until now, I've always been told that it fits. So I'd be really shocked now if it didn't fit.
So the training at home, is that more dressage work or leisure riding or more focused on jumping and...
No, well, I've never really been a jumper. Okay, so I do pole work with her on the lunge line, of course, or while riding. Cavaletti or something. I do that with her on the lunge line too.
You're quite the glutton too. That's very good.
Yes, she's a total glutton.
It's very, very good that you like treats so much, isn't it? Then we'll achieve a lot. She makes a very sweet impression though, doesn't she?
Yes, she is.
She has those big eyes, but... So 18 and did show jumping. How are the others? Have you ever had a dentist out? Has she ever had an osteopathic checkup? Or now... God, how long have you had her now?
3 years?
3 years. Oh, you know, that's actually quite a long while already.
Yeah, time really flies.
So I'll take the bare saddle without anything.
Yes, sure.
Then I can see a bit. If I notice something while riding, then I'll know if it's related to the saddle or not. Good girl. That's a good girl. So great. So, okay. And you had someone there who also looked at the saddle and everything?
Yes. Yes, there was at the saddler's too. It was adjusted to fit her then. And I also had my vet take a look at it. She also said that it fits. And the osteopath, who's been to see her twice, even recently again, has also always said that it fits.
How long ago was the last time? Was that several months ago or a year?
No, a few weeks.
A few weeks.
Yes.
Good. So then I'd say we'll go to this side first. So just come over here. Is this the spot where you usually saddle up, or further forward, further back?
Further forward, then I think it starts to tilt.
There?
Yes.
Okay. I'd like you to please come right over to the side so you can really see how this saddle is balanced. Would you say it's level? How would you have to place it now so that it's level in this position?
I think like this.
Okay, so then let me think about this for just a second. With your hand, I'll show you first. Go right at the front, basically under here a bit. Okay? So that you're really under the saddle up to here. Yes, basically along under this cushion. And just give it a gentle pull, you know. Do you see anything happening over there?
Yes.
Just try it yourself. See where the most pressure is, and if you can pull your finger through evenly everywhere, it's all good.
Yes, at the back, it's already starting here.
Okay, so now we'll go, I'll put it back there. So let's go to the other side. So you actually had quite a lot of pressure everywhere there, right?
Yes.
Now do the same thing on this side.
Yes, there's less here.
Where do you also have a spot with no pressure at all, where there's air?
A little bit here. And here it gets tighter again.
I only thought of it a little earlier because, you know, I saw her back, which, as you might expect, normally it absolutely belongs there without a doubt.
Yes.
Okay, if it were up, the saddle probably wouldn't be so dramatic right now. But now the thing is, you're telling me that the contact just isn't quite right, and it's honestly pretty difficult. To really get proper contact and that forward downward chewing motion, she'd actually have to be able to lift her back.
Yes.
So if I now add weight here as well, then you can already see the back goes down.
Yes.
Okay, when chewing forward downward, she's supposed to go down in front, which means she has to arch her back, but that's not possible. So, good, fine. Take a look like this. Oh, sorry. Exactly. Come behind the saddle for a moment. Come behind the saddle for a moment. So exactly. Usually you can see it better from further away. Then just take a look at this padding here and see if there's a difference.
Yes.
So what's up with the padding?
That's thicker.
It's much higher than the other one, right?
Yes.
So that means this is the side that also has the bridging. That's what you call it when only a part in the front and only in the back is touching. In the middle, there's air. That means she can't come up at all.
Yes.
Now that the situation has become so extremely severe, I honestly would not actually want you to ride with this particular saddle, even if it would be much more attractive for the camera and the film. I wouldn't want to put her through that now. Is it okay if we put a different saddle on?
Yes.
Okay.
And if you look at it like this.
A big one.
Yes.
But it's definitely not crooked. And it won't pinch like that. And I also hope that she'll get along well with it. That's why I asked.
Never sat in a dressage saddle.
Exactly. And that's why I asked if you usually do more dressage style work.
I had an all-purpose saddle so that I...
Both. I think, so we're going to need your pad. I'll just leave the trapezius pad underneath.
But not that pad, right?
We might use that later if we need to balance things out a bit. We can take a look first. So, and if you look here, right, you can already see these little bumps appearing because your saddle just pulls down right here. And there's lymph congestion here. This bump here, do you see it?
Yes, I've always wondered because it's so thick here and here.
It sinks in, exactly. But that's just the muscle that's atrophying here now. So it gets a muscle gap because it can't work in that area because the saddle is pressing down on it. So I have a trapezius muscle pad here now. It has cutouts right there if you'd like to feel it. Right, there's a hole exactly in that area so that the muscle can work.
Okay. Honestly, I really didn't know that something like that was actually out there.
I don't think it's been on the market for very long. And someone really put some thought into it. Although if a saddle really fits, you don't actually need it. There, that's good. So yes, I have to make sure it's in the right place here. There, good. Right, now it's also her back, of course. That goes down like that.
Mm-hmm. Yeah.
Right, but you know, we will manage that and we will get it all sorted out, honestly. So, you know, that's a good girl. Come here. So I think with her back shape, I'd really lean towards a saddle that has French panels. Those are those banana-shaped panels. Right, where they just curve away quickly back here. That's good. A little excited?
Yes.
Yes, how she'll be in a moment. It's all good. Flies, right? Good, that's a good girl. Good girl, great, super. You're going to do great in a bit, right? Yes, you're doing that very well. There, you're doing that great. Well done. That's literally on one. Yes, that's a good girl.
And does the bridle fit?
No, I was just checking if it's the same on both sides. In the same hole, I mean.
Yes.
That's a good girl.
But I always mount from a stool anyway. Should we stand there too?
I always do that. Very easy on the back.
Yes.
Good.
Pardon? Yeah, mounting is always a bit of a thing with us.
That doesn't matter. With that saddle, it's really no surprise. Because it's already painful just being cinched up. So come here. It's all good. Yes, look at that. Yes, look at that. Come here, come on. Yes, come here. Look. Oh, so skeptical. Just use the mounting block. I'll just stay here in front for a bit. So what does she do when you mount? Does she walk off right away?
Yeah, well, sometimes yes, sometimes she stays still. But sometimes as soon as I'm on, she just goes, or when I want to mount, she goes backwards or sideways.
Okay. Let's see, shall we? You're doing great, aren't you? Super great. Excellent, just mount up. So good, it's all fine. You're doing great, look at that. So I'll just let her walk on. That's good, exactly, all fine. So what might help exactly is if you just take the weight off your seat at first, staying forward a bit. Or maybe even stand in the stirrups a little bit first and then slowly sit down.
My goodness, this is completely different. It feels much better than mine.
So this is a saddle that just puts you right where you need to be.
Yes.
Where you need to sit. And those are now, I don't know, so if stirrups, I'd say for now, are fine.
Yes, I have a good feeling about them too.
Exactly, and feel free to keep the reins long for now so that she feels secure. Exactly. And we'll just stay up here in this area. We won't go down there at all. I think it's already totally great. I mean, lots of horses are afraid of this wooden horse. She's just marching right past it.
Yes.
It's 30 degrees in the shade. You're carrying a tray?
Yes.
Carry it right in front of you so the tray is level. That means you have to hold your forearms high enough to actually carry the tray.
Like this.
And on it is the most absolutely delicious drink you can possibly imagine, truly.
Yes.
And you mustn't spill a drop. So, if you can, go ahead and stop. Good, well done. So it would be this position, that's where the hand belongs.
That high?
Yes, that's where the hand goes. And I want you to keep this angle. It shouldn't go that way, and it shouldn't go that way. With your upper arm, you create tension. Hold your arm like this. Don't clamp it either.
Yeah.
But very lightly, just away. And here you're loose, relaxed, and loose. With this, you hold the position.
Yeah.
Okay, and with your hand, you work almost like a little snake dancer, like a belly dancer. Very supple here, very supple there, but it stays right there. Just a bit below that so that the water can flow away. In the walk, I've already seen many people do it. You tend to simply go along with the walk. The hand stays there in front and you push the walk with your lower seat. And that's good, right?
Yeah.
Just try it out first. Super. So that's your task for now, to really pay close attention to that, just as we discussed. Now, as you can see, the forearm is already starting to go down. So your job is to make sure to hold it high enough so that you can comfortably see your hands right there in front of you whenever you glance down. Take a moment to notice how that feels.
Yeah.
Exactly. And the hand, it actually always pushes forward if it does anything at all, not back. Okay?
Yeah.
Super. Great. Inner hand is going down again. I think because you want to take up the rein and position her to the inside. So, yes. Okay?
Wow, it's totally unusual to hold them so high.
So, this slightly higher hand.
I thought lower was better for the horse.
Now you have to see what your constitution is like. You have a long upper body. You are tall. If you now press your hand down, just do it. Go ahead and lower it. What are your shoulders doing up there?
Hanging.
They're hanging down forward. That means you have no tension left in your upright posture.
Yeah.
So that means you have to hold your hands high enough so that you can sit comfortably upright.
Yeah, okay.
Because only then can you be flexible and free. And stay mobile. Exactly. Always say, I'll hold them high enough so that I can comfortably sit up straight. Okay?
Yeah.
So then we have the problem that she doesn't lean in correctly, as you told me, that she doesn't chew forward and downward in a relaxed way. But you already noticed at the beginning, boy, I feel much safer in this saddle. That's why I already had this option in mind. To put you in a different saddle,
Yes.
because of course the horse's chewing also depends on how still the leg is and how quietly my rider is sitting up there. And that, of course, also always depends on the saddle. So good. Exactly. And halt. Great job. Look, I always have a little something.
So for me, I feel really enclosed in the saddle.
Yes, yes, of course.
I can't even describe it. It's really a huge difference. It feels much better and much more comfortable.
Yes, because it actually places you right in the center.
Yes. You feel so nicely enclosed.
Next building block. Now you're going to say, oh boy, that's why riding is a sport. So now you can clearly see when you look down from above that your knees are actually going over the knee rolls and your toes are gently pointing outwards. The problem when you do that is first, you no longer have a driving aid that gets your horse on the bit.
Yes, of course.
Back here is the wide part of the belly where they feel it. That means your lower leg has to be back here too.
Okay.
That means take it off. So off like that, a bit like that. So first just on the, relax here, just let it hang.
I'm letting it hang.
Good, like that. For me, it would be important now that you try to keep your thigh right there.
Yes.
And now stretch the leg long, then you'll actually need much longer stirrups.
Yes.
Take your foot out once. Look, step in once. Exactly. So thigh back into the saddle, right there. So, and the only task you're getting now, in addition to your hands up there, is to turn your thigh, move inwards. So,
Yes.
thigh inwards, meaning this position, and that shouldn't be lost.
Yes, I don't even know how I'm supposed to hold that.
So, that is the frame within which your horse moves. If she does not have a proper frame, because you are not maintaining enough tension by holding the correct position through your own muscle power, then your horse will not have any tension in her body either. Okay, so always think heels away from the horse. Heels away from the horse, even more.
Then I'm only on my little toe in the stirrups, so to speak.
Exactly.
So
if you tell yourself now heels away from the horse, what would that look like? Once I want you to hold that position, feel free to take a look from the side. Because now the knee is really where it should be. Heels away from the horse. Heels are... Which muscle do you need there now? Do you feel that?
yes. Everything.
I'll make it longer here too, so we can see a difference. This side, which is now adjusted, and then this one. We haven't adjusted this one yet. Just don't correct it. So this side looks completely different.
Okay.
So right by the girth on the horse. So now he's slouching forward again. So that means you have to permanently push your thigh back a bit with your thigh muscle and simply keep it back there with your lower leg.
Mm-hmm.
Simply. So great. A completely different picture. Excellent. So just remember again, heels away from the horse. I want to feel the belly at the back.
Yes.
So excellent. And feel free to include a change of rein. And again, heels away from the horse. And I feel my horse's belly at the back. That's where I place my legs. Yes, super excellent. Flawless. Heels away from the horse, that's very important because if you turn them outwards, then your gluteal muscle, your gluteus maximus tenses up because that's responsible for the outward rotation.
Yes.
And then your horse won't understand you anymore. Then the sit bones are over-tensioned by the muscle.
Yes.
That's why it's so important, especially when you're riding, to make sure to point your toes forward or at least towards the horse. I've found that the cue heels away from the horse is always understood faster. Exactly. So, well, absolutely excellent. Good.
She's in a great mood otherwise. I mean, she's totally sweet. You can tell she wants to do everything right.
Mm-hmm.
I know it's not her fault, you know, because honestly, it's just me.
Mm-hmm.
I just never knew how I could really do it. Because she or my other horses before, they naturally go into the posture, round down, and with her, you just have to work for it. But I also think it was because of the saddle in her back.
Yes.
So that she can't really move freely.
I've also just loosened the noseband by 2 holes now, making it a bit looser.
Yes.
Right, earlier. What I noticed is that towards the end she stopped, but before she was salivating a lot. That means it was really running out the foam. That's usually a sign of stress then.
Yes.
Right, so I thought I'd try it because they're supposed to chew in a relaxed way. But how is that supposed to work if their fingers are tied up like that?
Yes.
Right? Then it doesn't work. But it's actually quite common in the big stables, right? So the FN also says it should basically be able to fit a fist or palm under there without being squeezed. A flash strap like that seemed okay to me. It wasn't buckled too tight. I've seen it differently before.
Mm-hmm.
So Oops. The saddle is,
Yes.
yes, the seat needs to be larger, but I would really just use a deep seat saddle, right? This is a deep seat saddle.
I noticed it already. It was really, you feel so really,
It kind of cradles you a bit.
yes, so secure.
Mm-hmm.
Because I felt a bit lost in mine, but I just mainly made sure that for her, it's right. Okay, which isn't the case now either.
That must be a shock now, right?
Yes, it really is, no joke.
Yes, but it's unfortunately very, very common, as you might expect, when horses come here too. That's really how it is.
But she's such a sweet horse, and how she's also
She is.
ridden harshly.
Yes, I believe that.
How harshly she's ridden. And I just don't want it that way. I mean, this too much pressure.
That's not true.
Mm-hmm.
But she has nice movement. She cooperates well. So I wouldn't know what would stop an E or A level dressage, right?
Mm-hmm.
But E and A level dressage, for example, is really just about the seat.
Mm-hmm, yeah.
That's really how it is.
And that's kind of the basis.
When I look around, I don't even like going to showgrounds anymore. It is, well, yeah, I don't know. So a lot has been lost there. And I also have to say, it also has a bit to do with the rider's attitude. Many just they say, oh, I've already ridden a counter-canter, totally great. And they're such lesson fanatics. Whether it was correct, whether the horse really carried itself, whether it really used its abdominal muscles and everything, stepped under, that's just irrelevant then, right? So, and that's just how it's done somehow. And that, yeah. But they also choose the riding instructors who just let someone ride lessons just so they feel good, instead of saying, hey, look, I think we need to get the basics right first, so that you're sitting on there properly first.
There are too few who can still teach the basics.
Yes.
I mean, yeah, definitely.
Yes. Well, in most riding stables, you don't even get your horse ready yourself, right?
That's just, we don't even need to talk about that, right?
Okay. So, well, let's have a look then, shall we?
Yes.
So, did you feel like you were getting through a bit better?
Yes, totally. Like, that she understood me more. I think for her, it was also like, what's going on now? Mommy, what's up with you?
That is... Yeah, I'll pull it here in front. A lot of horses like that.
No, not at all. I do not think so.
They always find that great, right? Come here. So what I'm doing now is basically, I'll show it on the other side in a moment. I'm basically going up the zygomatic ridge to see if there are tissue changes that could possibly also indicate tooth hooks and things like that. Okay, the left side was more difficult, right?
Yes.
No. On the right side, she always comes into the center of the track because she doesn't want to go on the left rein. Left.
On the left, she also always pushes outwards when lunging, and on the right, she always comes in.
Good. So now take your fingers yourself and really go upwards here below this bone with a bit of pressure. Right, so I'm already denting it in a bit there. There will be some changes happening in the different areas up to this point. And just let me know if you feel anything at all, or what exactly you feel, if anything. Take a moment and be a bit careful, right? It's always more pleasant if you press slowly than if you... Feel anything anywhere?
To be honest, well, she's reacting here.
Yes. What's here? Once, yes, quite a hook.
Oh, yes. Well, I didn't press that hard.
And there too. Just very carefully and slowly move up with that gentle pressure and see where there are any lumps.
Here too.
She doesn't like it either, you can tell, right? So that gives me some insight now. This is the chewing muscle located here. And if there are dental problems, for example, or something like that, then the tissue in this area is often swollen as well.
She was completely swollen on the sides here.
Yeah.
Because in the pasture there's not much grass left and she always eats the short grass very quickly, and then everything here was thick too. I don't know if it might still be from that.
Up here is the jaw joint. If I press on it and she's in pain, she moves away. She's doing that, right?
Yes, of course.
So I'll say something about that in a moment. This side too. So I now have the possibility to at least gently wipe down the very first teeth on the outside here with my thumb. I wouldn't recommend doing that now. You can practice that if you feel like it.
Yeah, okay.
So, and I would say I can't look as far inside as when a mouth gag is on, or if a dental practitioner comes, they pull the tongue out to the side and can really go almost all the way to the top without getting their arm bitten off. I haven't dared to do that yet.
No.
I won't do it either. But from what I can feel here with the means I have and the signs I'm seeing, I would say the teeth are not okay.
Yes.
Right? And especially all these lumps here, you don't have them on this side. That means if she's supposed to step up to the left rein, whether it's bending on the left hand or yielding, she naturally gets stressed, because if there are sharp edges, which I can already feel the start of here, they constantly rub against the inside of the cheek like a stone in a shoe.
Yes, of course.
And when the noseband is on as well, you can imagine there's naturally quite a bit more pressure being applied to the horse's head. And that's why it's possible that she won't let herself go.
Yes, sure.
Right, in combination now with the saddle, with the unsteady seat, it's impossible for her to do anything. So a dental practitioner, you know, someone who works with teeth and oral health, then
Yeah, sure.
I would really say, to be honest, a dentist or a dental practitioner or whatever you want to call it, because I simply go to the dentist with a toothache and not to a general practitioner. Many people call the vet or go to the clinic or something else.
Yes, we went through that with him.
You're doing great. Then something's not right up here either. That's the case because the pole is twisted. It's like this. If you hook in behind here,
Yes, sure.
then you can really feel it, you know, and it's basically turned in that direction, just like that. Turned in this direction. Unfortunately, it doesn't help to just quote unquote pop it back in. Popping back in doesn't really exist because nothing can pop out.
Yes, sure.
Right? It can only shift itself into one position and then it ends up getting stuck there, unable to move again. And it's held in place by the muscles.
Yes, sure.
And I can turn it back to its original position now. But the muscles in her neck, which have been used to turning it that way for weeks or even years, will instantly pull it back there the next time she shakes her head or jerks it up. So that means it's a matter of gymnastics, of riding, of muscle training to balance that out.
Yes.
And first, let's talk about the basics here. Getting the teeth done properly and making sure everything is taken care of so that this issue up here doesn't have to happen anymore.
Yeah.
That's why you don't usually see me doing much popping back in during a checkup, you know?
No, it's more about checking where everything is.
Right? So, you know, good girl, right? So what you can see quite well here is I'm really putting my hand up here, right on the first and second cervical vertebrae, which are located at the very top of the spine, just beneath the base of the skull, right? And now, at this point, I'm trying very carefully and gently to just get her to turn here, making sure not to apply too much pressure. And if you look from the side here, you can see that it's almost like a stick, very straight and rigid in appearance. Now she's giving in very, very slightly, but now she's already pulling back. That always means, oh, no, 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 I don't want to.
Yeah.
But on this side, it's somewhat okay. On this side here,
She has a gap.
but that feels good for her, right? Snorting. So I'm doing the same thing on this side. So, and she's already resisting immediately. Now she's getting tight and pulling against me. And then you can also see here
Yes.
how everything here seems to start to tense up and swell.
Jawbone.
Exactly, right there. Underneath you see are also lymph nodes and all that, right?
Yes, it's thick.
But a lot of horses have that. It just happens if she was a show jumper for example, or also horses that are ridden on the bit a lot, those with a curb bit who are often ridden in an upright position, they get that a lot too, right? When they're just always kept in a tight frame and in between, they don't always have the chance to chew again.
Yeah.
Right? So what I would say here is if she's already doing that, taking this treat from here, on both sides, that's already really, really good. What I would give as an additional tip for the neck area is really grab into the crest of the mane, not up there. That hurts us too, right? At the base. But right at the base, and then you start by, don't do it too hard now. I would stay very gentle there. The lower lip, right? So try it yourself once. In this area where it's fleshy, the spinous processes are only down here, you can do it harder. Up here, there isn't much surface area, so you have to be a bit softer and more sensitive up here. So I start down here and I really take it right at the bottom of the skin. And I also try not to claw at the skin. I just need something to... The principle is that I basically pull it down here and release it again. That I basically do the whole nuchal ligament here. She really loves that. Yes. Right? Because that takes away a lot of pressure. Okay. Right? And I only do it in this direction, correct? Exactly. And downwards in between. And that also works with the side. No. So and feel free to try to do it faster. To do it faster because spasticity in humans, for example, is released through small oscillating movements, small shakes, open up tension. That's why what you can easily do yourself to just get some relaxation in there. Yes, of course. The other thing is, of course, up here, really very, very, if you come over here, good. It's really tight here. Yes, it's also so high. Exactly, it stays there. So you really want to massage here very lightly and gently and with a bit of feeling, with just a little pressure. Really massage a bit here, taking your time. Yes, slowly and very importantly, a bit of feeling must also go through your fingers with care and attention, bit by bit, as you continue. A bit, it's okay. So honestly, that's perfectly fine. So that really hurts. Yeah. And then she'll give in a moment. And then she'll be hanging there with her head down. I did something with her in circular motions on both sides, but higher. And I'm going along here now because that's just how the muscle fiber runs. Yeah. It's then easier for the horses to give in. Fine, okay, that's one thing that you can also do. The other thing is that she's relatively small at 180, it's always a bit more difficult, is that you take all the tension away from her for once. That means I really go under here and slowly, carefully take the weight of her head off her shoulders. So, and up here, she finds herself. Now she's about to gently shake her head in some direction. And here too, I shake and go to the side, moving with care and attention. Yes, fine, she'd like that on this side. This way you have the possibility that the vertebral bodies come back themselves without me having to adjust them, because there's no tension now. Ah, look at that. So you can easily do that yourself. Yeah, it's got something good. Try it out. It looks very easy, but it's very hard. Really stand wide and don't arch your back, but tense your abdominal muscles beforehand and then go up to it. Try it out. So first reach underneath. Exactly. The important thing is I really reach under like this. It's important that you keep your fingers apart and don't do the normal reflex and squeeze. That's unpleasant. It's just like a support. Yeah. And then I always use both hands, basically. Stand in front of her, right in front. I have to think about it. Exactly. And then just don't press but away. You have to go directly under there. Otherwise, it'll be all the way under. So, exactly. Don't press here. Exactly. So, now just start slowly. It's all good. Fine. So, just going up and down. First of all, it's like this, that you really... I'm pulling her towards me a bit now. Okay. You really must go all the way up, all the way to the very top. So, and I'll just go along with it for a bit first. So, and now I'm standing directly under her, otherwise I won't get her up. Oh, I see, yeah. Stretch all the way through. Fine. She finds it. It's just, yeah, now she doesn't think it's so great anymore. Just lift it up once so you get the feel for it and then let it back down. It's doing her good. Try to get it up once because that's very important. Stand in front of her, otherwise it won't work. Lift a bit and then go underneath her. And see how much she gives in and then look a bit, So, and then you basically hold her up there, but let her move her head however she wants. Or shake slightly and move in that direction yourself. So, and then you go over there once. Exactly. Then you also go once in the other direction. Slowly, slowly. And then you let it back down for now. She's already chewing.
Good girl.
Okay?
Yes.
So also good to do because she's very sensitive. She's sagging a bit right now. That means she actually needs daily passive training so that she comes up.
Yes.
Active training is then riding forward, downward, for example, or lunging forward, downward. So I'm really going down here with my fingers, specifically in the saddle area.
Mm-hmm.
Come up.
Yes.
So, and I'll do that for a bit longer so that she stays up there nicely. That way I get a nice distance between the spinous processes. Very good. So, and in this position, the back naturally stretches the neutral ligament. And the moment she moves, vertebrae can also pop back in, as you can see.
Yes.
Would I let her sag? No.
No.
Good girl. Very great. That's great, isn't it? So we have one more thing. What would also be really important right now, I think, would be the lumbar spine. I can't reach that from the front. I have to do it from the back.
Mm-hmm.
That means if you were to go along the very top here, she would really arch her back, you know?
Yes.
Wait, stand still. Good girl. So if I were to go along here, look there, then she tenses up here and flattens out.
Yes.
So we don't want that because she's already sagging anyway.
Mm-hmm.
What we want is this right here, and you'll look for these points in a moment. It starts up here as I prepare, and as I move down, I apply more and more pressure. With her, you need a lot of pressure. Now I'm pressing and almost nothing is happening. Let's try. No, actually, the pressure is up here.
Oh, I see.
Does she kick? Otherwise, I wouldn't stand behind her.
No.
Or something like that. There's nothing left down there. Yeah, almost nothing is happening there. It's very, very difficult.
I managed to do it twice with her.
That's why I have something like this. Of course, you can also use a hoof pick or a spur. Just be really careful at first because you don't have a feel for how hard you're doing it. Right? So these are acupressure sticks.
Mm-hmm.
For the somewhat, there are round buttons. I'll just take the slightly smaller ones and run them very lightly down here. Oh, did you hear that?
I heard that. Yes. Crack, crack, crack.
So, and that's what was holding her back down there. Now, everyone would probably say, well, they were dislocated, out of joint. Basically, they just got stuck in that sway back position, and that was it, really. It was as if they simply could not move out of that posture no matter what they tried. Yes, a spine moves up and down to all sides. And it can happen that if a horse suddenly jerks its head up while the saddle is still on, the spine makes a normal movement, namely bending downwards so that the head can come up. And then there's the situation where these vertebrae don't come back up.
Yes?
Even when the horse lowers its head again. And that's what you actually evaluate during a treatment and make it move normally again.
Yeah.
If you go ahead and put your saddle back on right now, you'll find that it'll just end up right back down there again, just like before. And with my fingers, I wouldn't have had a chance to get her past that.
Yeah, sure.
Well, now it will probably be a bit easier, I think.
Now she's not standing straight anymore either.
Fine, good girl. So that's already...
The way it cracked. She cracks a lot in her neck, right? Even when I do the exercise. But it hasn't cracked that much in the back yet.
Look, like this. I'm doing that to the side now too.
Okay.
Right? So what that means is that she should gently arch up and then move to the side just a little bit. Fine, that's good, good girl, right? Now, by doing this, I might also be able to get the sacroiliac joint. And of course, I can address the lateral bend as well. This way, we're making sure to target both the joint and the bend, which is really important for her movement and comfort.
But she's doing well, isn't she?
Now she's doing it well.
Yes, sure.
Okay, well done. That was really great. So just try to stay calm and relaxed at home. Take it easy and don't stress yourself out. Also, you might want to try using a blunt spur or maybe a little wheel or something similar. Just make sure to use it very lightly and gently. And remember, don't press hard at all. Take your time and be patient with yourself as you try these things. You started up here, so the spine knows that something is coming, even though I'm not doing much.
Yeah, sure.
That's where I want to go. And in the end, I say this is actually where it stops. If you go further, you might get a kick. That's always worth a lot, right?
Yes.
When the horse accepts it, right? That's always...
Yes, you've done great.
So was everything easy to understand? Can you work with that?
Yes, very easy to understand.
Great.
The fact that I can do it at home too is good.
Yes, excellent. Then I would say, thank you very much. I actually received a really nice saddle pad as a gift, even with the logo on it.
On both sides.
On both sides in blue. My color's really great. Where did you have that made?
Yes, we do that ourselves in-house. We have the HKM brand in our range, for example, and you can get everything for horse and rider from us as team equipment for the stable, for tournaments, or even with a company logo. Starting from just one piece, with various or all colors and sizes to choose from.
So you mean you have the saddle pads there yourself? You don't just do the printing and stuff?
Yes, we have everything there.
That's amazing.
For one thing, we have the entire HKM range there for some small items. Yes, you have packaging units, for example, but for the saddle pads, they're individual pieces, or for sweat rugs too.
Okay. Yes, cool. How do I find you on the internet if I wanted to get something?
At www.wilken-concept.de.
That might be cool if I include that in the video instructions below, in the video description. So whoever has a need for that, they'll just find it down there. Is that okay with you?
Exactly. Yes, just call or write an email. Then we'll get it sorted.
Cool. Yes, then I'll say thank you for now. And feel free to give some feedback.
Yes. I think we'll come back again.
Yes, no problem at all.
Yes, because it's just close by, which is nice, right? Because you notice the difference immediately. I've never had that before, noticing the difference so directly.
I'm glad to hear that. I'm glad to hear that.
It was really a very good decision to come here.
Yeah, great. Thank you. Then I'd say let's just stay in touch. And if you want to come back for training, right, or even when the saddle is just ready maybe, when the saddler is actually there, just take a photo or something like that when the saddle is on there. Well, but I think from the feel of it, like when the saddle is on, you can already feel that a bit yourself now.
Yeah.
Right? When it lifts at the back.
Yeah.
Yeah? Good. I wish you a nice drive home for now.
Thanks.
And have fun with the sore muscles.
Yeah, well, it's okay right now. Carla's having a real detox treatment now.